It has been an unusually quiet night this Friday night in the medical and surgical emergency clinics. But shortly before 3 in the morning, that is all forgotten. Members of the SEC scramble to get room 41 ready for this. He is 20 years old. He has a devastating stab wound. His heart has stopped beating. The SEC team starts going as hard as it can go.
1, 2, 3. Wait. 1, 2, 3, go.
Coming out.
Stab in the right chest.
Okay.
The man has a deep stab wound to the right chest. He was rushed to Grady from Decatur. It's tough enough to win in the emergency room when the odds are even, but when the odds are stacked against you.
You ready? Can you see it? Can you see it?
Dr. Paul Horton tries to clear an airway to allow the victim to breathe. He is not sure he can do it down the throat. He keeps trying as long as it is practical. Then he orders an oxygen mask be put over the man's nose and mouth.
Let's give him 2 amps of bicarb. Let's give him an amp of epinephrine. Over here.
Establishing an airway is the top priority. Getting the heart to start beating again is the next one. Horton calls for bicarbonate and epinephrine to be administered. The first one counteracts the acids that develop when the heart is in arrest. The second one is a heart stimulant. And all the while, someone continues external heart massage.
Our responsibility, take vital signs, sort of assess the patient, do about a 60-second assessment to see exactly what he needs. Most of the time, we usually know what to do. We've seen enough to where we know what to expect. We sort of anticipate the doctor's needs.
Lines are hooked up to get drugs and fluids into the man's system to keep the blood vessels open.
Put it up all the way.
Horton asks that oxygen be pumped full blast into the breathing mask. It is controlled chaos. There are maybe a half-dozen critical functions that must be performed if this man is to have any chance at all.
Where's that pericarditis centesis tray? No. Let's give another epi, yeah. Okay, auto transfuse setup. Let's get it ready. There's a bunch of blood in there. Where's that pericarditis centesis tray?
Is there any suction on it yet?
Where's the pericarditis centesis tray? I'll get it myself.
Horton is asking for something called the pericardial synthesis. It is a device which pumps fluid out of the cavity surrounding the heart. That fluid can prevent the heart from beating. In the confusion of this all-out sprint to save a life, Horton gets it himself. In the meantime, this man is not responding.
He's got no breath sounds on
Getting nothing over here. Just tell him we got a full arrest. Stab in the chest.
Whenever an emergency room faces a life or death situation, the Grady trauma team is called in. The trauma team is the SWAT team of emergency medicine.
The trauma team at Grady works on a 24-hour basis, 24 hours off, 24 hours on. We have 2 teams consisting of 5 doctors. And if you have major life-threatening emergencies coming in, we call down the trauma team that takes care of stabilizing patients and getting them to OR as soon as possible.
Trauma arrives. The doctor talks with Horton to be brought up to date. The external heart massage continues. More bicarbonate, more epinephrine. The victim is not responding. A critical decision is made.
Give me the open floor cotton tray. I need some betadine for his chest, a pair of gloves.
Okay, we're going to open it.
Here, Paul.
The nurse calls for betadine, an antiseptic. The team in room 41 is going to open this man's chest. It is a last resort. Perhaps direct heart massage, perhaps direct treatment of the severed blood vessels will save his life. There isn't much else left. And if it is possible, the intensity increases.
Hey, I've got a jugular up here. I got a right peripheral. I don't have a 20 blade. One on the tray.
Syringe.
You go, Dr. Horton.
The tools are prepared, and the chest is open.
I need a pair of pickups here, and I need a pair of mayos. We have mayos. There aren't any.
Let's give another amp. Let's give another amp of bicarb.
You got it.
Okay, good. What's his rhythm now?
A member of the trauma team begins massaging the heart. Another decision is made.
Yeah, we need to shock him. Course fifth. You all let me know before you shock him.
Shock the victim's heart. Shock it in hopes that it will start beating. There is some irregular movement.
He's got fib on left foot.
I'm sorry.
You want to shock him once and see.
That won't shock. If you want to shock that.
He needs another amp bicarb, too.
It has been 18 minutes since room 41 started fighting to save this life. The heart has not responded. This man is dead.
They just come in. Okay.
3:15.
There is that inevitable letdown after such an intense, almost frenzied effort. But it is not over yet for Dr. Paul Horton.
Do you have any family here with him?
Those who are responsible for maintaining life must also face death. Dr. Horton and his assistants make a vain attempt to soothe the burning grief of the friends and family who have just lost a loved one.
You go home and you think about what you did, and you try and reassure yourself that you did everything that you could, because that's what we do. We do everything that we can, and sometimes it's just not enough.
Marc Pickard, Action News.
Yeah, Brian, you better.
Wait, 1, 2, 3. Wait. 1, 2, 3, go.
Coming out.
Stab in the right chest.
He has a deep stab wound to his right chest. His heart has stopped beating. He is 20 years old, and the team in the surgical emergency clinic is fighting stiff odds to save his life.
Let's give him 2 amps of bicarb. Let's give him an amp of epinephrine.
Dr. Paul Horton and his team set in motion the half dozen or more critical functions that must be executed almost simultaneously if this man is to survive. He tries to get an air tube down the throat and then opts for an oxygen mask over the face. He makes sure intravenous lines are set to keep fluids flowing through the blood vessels.
Yeah, let's give him an amp of calcium chloride, please.
Okay.
And he calls for drugs like sodium bicarbonate, epinephrine, calcium chloride, drugs to counteract the acid caused by cardiac arrest, drugs to stimulate the heart, drugs to fight infection.
Yes, we have a full arrest of SSA stab in the right chest.
An emergency medical technician tells a member of Grady's trauma team what's going on. The trauma team is the SWAT team of emergency medicine. 5 people on each of 2 teams at Grady are specially trained to handle life or death situations, and they are on their way down to room 41.
What do you want?
This man is not responding. The team in SEC decides to open his chest to apply direct massage to the heart. It is a decision made maybe once every 2 years.
Yeah, we need to shock him, of course, you all let me know before you shock him.
Well, we sure will.
The team tries to shock the heart into pumping. It does not work. Nothing works. After 18 minutes of frantic effort, this man is pronounced dead. But it is not quite over for Dr. Paul Horton. He has borne the struggle to keep one man alive. Now he must bear the grief that death brings to friends and family. Marc Pickard, Action News Tonight.